So last class, what did we discuss? We completed causticum. Okay. Any questions? Anything you would like to add as a PG scholar? See, purposely we have not touched the particulars because we already dedicated some 7 or 8 classes exclusively for causticum. Okay. So I'll start with a new remedy. See now, particulars I have not touched, but I have given you the ailments from pathogenesis and characteristic symptoms. That should be good enough, and that will give you an idea what the particular symptoms will be. Okay. I will start with a brand new remedy. Before I start the remedy, I will just share a small case. A case which had come last night to the clinic, and it was a follow-up case. And luckily, that case has some relevance to today's topic. So I thought I'll just share the follow-up of the case and then we will try to take the class further. See, this gentleman should be around 38-40 years old. Okay, and 3-4 weeks back, he with his family, they had been to North India trip. Unfortunately, something happened, and he had to give water to his daughter. They were traveling in tempo traveler. Okay, so when he stood up to give water to the daughter, for some reason the driver applied brake. So this man who was sitting behind, he literally went ahead because of the brake, and he hit himself over his chest. Okay, and he became very serious, meaning he had dyspnea, he had difficulty in breathing, and immediately they rushed to some big hospital in Delhi. So there they kept him for observation. They took a CT, and luckily there was no major issues. Fine, and they did some first aid, and they sent him. Okay, so he came back, and 15 days back he came to my clinic. He is a very good patient of mine, very old patient of mine. But what is the problem is, though it happened 15 days back, the entire area, the chest area, the rib cage was still badly paining. CT, X-ray, the blood investigations, whatever they did that day, it was absolutely fine. But that pain persisted. As a PG scholar, now yesterday after I gave him a remedy, he is much better. Okay, pains are much better. Now, how do you analyze, how do you come to a conclusion which is the remedy that you have to prescribe? We'll have a small discussion and then I'll introduce the remedy. Hope the case is clear. Fine? Okay. See, now when I say I analyze, I didn't, what is the word I didn't purposely use? I didn't ask the remedy. Fine? And we are all very eager, very impatient to talk the remedy. I know remedy will come, definitely it will come. Dr. Aniket already came up with a remedy. And the remedies? What is the remedy he came up with? Arnica. Good, he came up with arnica. Now, the question is it arnica or is it something else? See, when I use this word, is it arnica or is it something else, then what is that you missed here? In the hurry, you missed to analyze. I gave you the situation. I don't know how dramatic I was, but I gave you the situation. Now, what remedies is the second question. Now, how do you analyze this case? What could have happened? Why is he still suffering with pain? What is the target organ? Now, this is where today's class will be focusing on. Okay. Now, why not arnica? Okay, I mean, yeah, I gave you a small clue, it was not arnica. Okay, but why not arnica? See, okay, it is not recent. Arnica is also a very good remedy for injuries which can be recent or which can be old. No issues. But why I did not think of arnica? Though As a first year student, you all know arnica is one top remedy for injuries. Injuries. I gave you a small clue. I use the word. What is the target organ? What was that got injured, that got affected? And where is the pain the patient is complaining of? Okay. Now, where is the pain the patient is complaining of? I use the word rib cage. Fine. I use the word rib cage. So, will it make any difference now? Or you still want to stick on with arnica? Huh? Huh, okay. No, see, it was a simple emotion. She wanted water. We stood up to give water. Okay, Dr. Aniket is going beyond. Fine. See, I mean, I appreciate. In some classes, I myself would have told, some emotion, something. But it was an incident. If you just, I don't know, was he angry because the doctor asked water, or he felt bad, she's asking water? I really don't know. I didn't look at that point. Yeah, he's got a point.
After the thing happened, it is like a shocking thing.
Okay.
So, any effect was there mentally after that incident?
To be very honest, I propagate this kind of homeopathy, but unfortunately, in this case, I did not ask all those things. Aniket has a point. Daughter asked water. Fine. He stood. See, when he stood, many times you would have seen cases, they would have given water, they would have drank water, nothing would have happened. Why only in this case, when he stood up to give water, the driver had to apply the brake, he had to go hit, and he had to go hit over the chest. Fine? Okay. I mean, yes, there's a point. But I didn't dig in deep. Okay. And Vaishnav wants to know if he had a shock. I mean, seriously, I did not question that. See, they have done all the investigations. He was not able to breathe. Okay. Could be because of shock. Could be because of that impact of the injury. He was in a state of shock. Agreed, good. Now, has he come to me for that state of shock to treat? That is all gone. You are getting my point. He is walking around from Delhi, they flew back to Bangalore, he is going to his work, everything. But what is remaining? That pain. And where is that pain? Rib cage. Must be we have taken homeopathy to a little higher extent. You are not able to think small things. Now you are talking of emotion, you are talking of the impact, but in the bargain, we are missing simple things. Okay, soft tissue, rib cage. Okay, costochondritis, good, fine. Okay, can we slowly move towards the remedy? Which is the remedy? Which is the remedy? Okay, very good, ruta. Good, could be ruta. No issues. Ranunculus bulbosa. When do we think of ranunculus? Yeah, see, what is misguiding for you here is the area. Now, what happens in ranunculus? It is intercostal neuralgia and post-herpetic neuralgia. Ranunculus is a beautiful remedy. Now, how did it start? What happened? So, a simple clue is we need to have an injury remedy. Okay, and where is the injury to? Injury to the ribs. Though the ribs did not go into fracture, okay, but the injury was to the ribs, rib cage. So, one remedy that will come up here is a simple remedy. See, I gave him Symphytum 200. Okay. Yeah, it could be Bellis, it could be Ruta. I have nothing against. But keeping that affinity for bone and the after pains of an injury to the bone, the remedy that stuck there was Symphytum. And Symphytum was given, and he comes to the follow-up yesterday with beautiful improvement. Okay. So, today's topic is not Symphytum. It's not Symphytum because I told you the patient just came yesterday, it was a coincidence. But Symphytum will definitely come up in the discussion, and we will again get back to this case. See, now I don't know if the image is clear, and this is pure flints, silica. Okay, and I am directly coming to the remedy, name of the remedy. The remedy we are going to discuss today is Silicea. okay, Silicea. And I was just referring the source books, and I was referring Richard Hughes. And Richard Hughes mentioned in his book, see, flint was first used. It was not Dr. Hahnemann who introduced Silicea to the medical world. Okay, we'll get back to Dr. Hahnemann, what was his contribution after 2 minutes. But Silicea as a remedy was used by Paracelsus, okay, and his followers. And if you look into the history, they used it for renal and bladder calculi, okay. And it was also used in suppression of milk and urine and in some nervous disorders. This is what Richard Hughes writes in his pharmacodynamics. Okay. Now the next very important thing, my favorite book, E. A. Farrington, Clinical Materia Medica. When I was reading this, the first few lines of Silicea in E. A. Farrington, he writes this. He says, in its crude form, Silicea is very inert. We have all done pharmacy, and we have also done that process of trituration. So what he says is, it is insoluble and hence has little effect on the system. When potentized according to the formula of Hahnemann, it becomes one of the most valuable drugs in our materia medica. This is the statement given by Dr. E. A. Farrington. Now, many of the homeopathic remedies, okay, especially the minerals that we prepare, majority of them, they are inert, fine. But once you potentize, okay, then the effect is entirely different. So the credit of giving Silicea to the medical world goes to Dr. Hahnemann, okay. And as a practitioner, we have used Silicea in various cases. If time permits, we will also look into those cases where Silicea was prescribed. So we will move ahead. This is just a brief introduction, what Silicea is, and where do we see Silicea commonly? It is seen in sand. The major composition of sand is Silicea, okay. Lot of things mentioned in Wikipedia. I will not go into the details because we need to focus on the remedy, okay. So we will get back to the next very important thing. What is it that we are going to do for next 30-40 minutes? What this class is going to offer you, that is very important. Now, in this class, we will be exclusively focusing on pathogenesis of Silicea. See, pathogenesis as a component is very, very important, okay. Now, I ruled out arnica in this injury because arnica will not cause injury to bones, fine, okay. Probably the closest would have been ruta, but the pain was per se over the ribs, over the bones. So I thought of symphytum. We will discuss a little later. Now, I am going one more step deeper, and I am giving you few tips that you will be taking home. Now, what is that I am trying to focus here is to understand pathogenesis. This is a very crucial point. To understand pathogenesis of a drug, what is that knowledge that is required? See, many times materia medica as a subject, for many of you it is a boring subject, fine. Many feels materia medica has same things, has same symptoms, and it is very vast, very huge. How do I remember? When you understand a remedy in a systematic way, then materia will be the most loved subject. And it is our bread and butter. I am not promoting materia medica subject because I am a materia teacher. But as a practitioner, you also know materia becomes very, very important. And if you understand pathogenesis, trust me, this you start falling in love with materia. Now a simple question, what is it that is important to understand the pathogenesis? What knowledge you should have? Now if there is some confusion, what is pathogenesis? See, like there are two things I have repeatedly insisted. One is sphere of action and next is pathogenesis. What is sphere of action? Sphere of action is where exactly the remedy is acting. Now what is pathogenesis? The process or acting on that particular part. What is this leading to? Now that process, fine. For example, acting on liver, it will cause hepatitis, or acting on liver, it will cause cirrhosis, fine. So sphere of action is liver, but then what is it causing? Acting on that, that will become very important. And these are all minor things which will help you become a better practitioner tomorrow. Okay? You will have chelidonium, you will have Crotalus horridus acting on liver. Now, when chelidonium, when Crotalus horridus in liver affections, you will understand if you know the pathogenesis. Okay? Hope the importance of this topic is justified. Fine. Tomorrow you will repetize, you will get a series of remedies. Then again it is your materia medica knowledge. Then you will go back to your materia medica, you will understand, is this remedy having so much of capacity to cause such grave disease? Fine. So pathogenesis will become very, very important. An extended question, what I have asked you here is, what makes or what are all the other knowledge of other subjects you should have so that you understand pathogenesis better? That is a simple question. Okay, you should have knowledge of physiology, more than knowledge of, see, one thing you missed before you jump to pathology, knowledge of anatomy. We are going systematic. We are going from first year. So knowledge of anatomy, knowledge of physiology, and of course knowledge of pharmacy. Pharmacy. Because what pharmacy tells us? Yeah, the active principles, where exactly they act, why they act. Fine. Pharmacognosy, whatever. There is a part of branch of pharmacy which will tell you more in detail about these things. So these three subjects, hope I have put it in an order, knowledge of anatomy. Fine. So during drug proving, when a remedy is taken, where is it bringing changes? Okay, that will become very important. So knowledge of anatomy, knowledge of physiology. See, you know it is acting on liver, knowledge of anatomy. Now, what is it doing acting on liver? If you have to understand, you should know knowledge of physiology. Okay, and probably this is where you also realize many great allopers, fine, they can explain materia medica better. See, E.F. Harrington, Kent, okay, or even for example Herring, Clark, majority of them if you see, they were all allopers. For that matter, Hahnemann himself, he was an allopath. So their materia medicas, especially E.F. Harrington, he will reason you, he will give you reasons why cinchona is acting on this, why ophidia is acting on that. He will give you a beautiful reasoning. Many times we feel materia boring. Many times as a materia teacher, I can't convey things because we fail there in giving you a reason why this remedy is acting here, causing this. That clarity you will have when you understand pathogenesis. Okay. So knowledge of anatomy, physiology, pharmacy, I just spoke to you. Now we will come to what you are trying to tell me. Knowledge of pathology, very important, very important. Fine. From the inflammation, the systemic pathology, all those things, they become very important. And pathology, if you start understanding pathology from homeopathic point of view, what is it? Homeopathic point of view, miasms. It will be great. Fine. And if you understand miasms, then allied subjects, you can start playing with allied subjects. You know what psora is, you know what psychosis is, you know what syphilis is. Fine. So we'll go ahead, and I have also insisted in my previous class, the knowledge of forensic medicine is very, very important. Why is it important? Which part of forensic medicine becomes important for us in understanding materia medica? Toxic, yeah, very good. Poisoning, toxicology. See, arsenic poisoning. If you read arsenic as a teacher or as a student, and if you read arsenic poisoning, you will be convinced. Our materia medica has all those things. And you know, poisoning is a source of materia medica. Fine. So please, I don't know, now that we have all finished reading forensic, but as a student, you know, when you are reading, the toxicological part of forensic medicine becomes very important to understand materia medica. Okay. We'll go ahead. I have just used the word medicine here, but we should use the word allied subjects. Okay. Knowledge of medicine, knowledge of OBG, knowledge of surgery. This again will help you understand pathogenesis better. Anything else you would like to add before we go to the next slide? There's some very important thing that's missing here. Just give a small thought and we'll get back. What is that small thing that is missing here? In this slide, don't look at my face. In this slide, what is it that is missing? Feel free. See, right, wrong is not an issue. But to understand pathogenesis, these things are important. Agreed? One very important thing is missing. Now what is that? What is that one very important thing that is missing here is knowledge of knowledge of organon. And specifically, if you are looking at pathogenesis, knowledge of miasm. I will explain. Why knowledge of miasm is important in understanding pathogenesis. Can I have some quick inputs?
If it just produces an inflammation,
Okay.
or it
Yeah.
directly goes to ulcer.
Very good. Agreed. See, now if you read miasm, now you apply this to your materia medica and you see how beautiful it will be. See, when you look at the miasmatic background, there are few remedies which are predominantly syphilitic. Okay. There are few remedies which are psoric. There are few remedies which are psychotic. Fine. Okay. So a remedy which is psychotic will have a tendency to produce more of growths. In the pathogenesis, you will see more of growths. A remedy which is psoric will stop at the level of inflammation. And a remedy which is syphilitic, in the pathogenesis, you would have seen, or in our clinical observation, we would have observed that it can cure ulcers. So, a sound knowledge of organon is very important in understanding pathogenesis. Okay. Are you all clear with this? Convinced? Anything you would like to ask? Add. See, these are all my thoughts. I may be wrong, fine, or I might be right. But I am putting it across. Okay. And if there are anything you would like to add, I am open, because these are all freshly prepared for today's class. Fine. Some thought comes, I just type it and I am putting it across. Okay. So if you feel something can be included, yes, in the next class we can add that also. Kindly think over and let me know. But at least you are convinced, to understand pathogenesis, we should have a sound knowledge of all these subjects. So now you realize how difficult materia medica is. Otherwise, what we generally do, materia medica, okay, nux vomica, we just by heart. But if you apply, then that's the beautiful thing, and nobody can erase it from your memory. So there is a way of understanding things. Okay. Now this is how you need to understand. Now we'll get back to Silicea. Now this is what I am going to apply in today's class. Okay, and we look at the pathogenesis of Silicea. Again, I have taken this from, one of the one of the student was asking, sir, which books do you refer? Okay, see, the books that I refer, it depends. For example, pathogenesis, common books I refer is Burt, Physiological Materia Medica by Burt. We have Richard Hughes, beautiful book, and of course Fatak, okay, and E.A. Farrington. Fine. So this will give us some clarity about the pathogenesis. And for different topics, the books will change. Okay. Now we'll look at this. See what they say is, especially E.A. Farrington says, now this is a remedy which mainly affects the nutrition. Okay. Fine. It is a nutritive thing. It affects the nutrition. Nutrition of the bone, nutrition of the nerves, whatever. It mainly affects the nutrition. Okay. So it is a deep acting polycrust remedy having predominant action on. Okay. We are straight away looking at the sphere of action and pathogenesis. See, now I will just give you a clarity with example what is sphere of action and what is pathogenesis. For example, Silicea acts on bone and the fibrous tissue. Now what is this? This is sphere of action. Okay. Now what is the next question that comes up? What is Silicea doing? Acting on bones and acting on fibrous tissue. Now that process is what we call it as pathogenesis. Okay. So any wild guess what is Silicea doing? Acting on bones and the fibrous tissue. Now this is where the knowledge of miasms become very important. Okay. Yeah, anyway, very good, beautiful. Dr. Aniket has a point, but he has gone directly to what is decay of bones? Which miasm? Syphilis. Syphilis. Okay. Yeah. So before that, what you also have in Silicea is it mainly causes. Now before that, I also wanted a point. What did I tell you? It is responsible for the bone development. It is a nutritive thing. Fine. So what is happening is, when there is a defect in the nutrition, the bone formation, all those things can go into problems. So the first thing you also see here is, there might be a defective formation because Silicea is affecting the nutrition of the bone. Okay. Now the second very important thing is, it is causing inflammation. Inflammation of what? It can cause inflammation of bones. What is it called? Inflammation of periosteum, or it can also cause inflammation of bone marrow. So inflammation of bone, periosteum, or inflammation of the bone marrow. Now what you also see here is, Silicea causes destruction of the bones. This is given very strongly in many source books. Okay, you can either refer Bory, Clark, Fatak's, fine, Kent, even Herring. I mean all those great authors, E.A. Farrington, they have very strongly recommended Silicea for destruction of bone. Okay. Aniket used the word caries. Yes, caries. Now again, from my clinical experience, I will be sharing 2 or 3 cases. It is a beautiful remedy for what is it? Osteomyelitis. Luckily, I have a very good ortho friend who believes in homeopathy. He takes, his family members take, and he is that open. Whatever cases he feels is a limitation in his system, he refers to me. Very rare to get a gentleman like him. Fine. Because he is very open. Sir, this is my limitation. Please see if you can do something. Fine. And we as homeopaths, we have our own limitation, and we should be fair enough to take help from the other systems. Okay. Now this gentleman had almost referred some 4 to 5 cases of osteomyelitis. Okay. And way back, probably in 2000, first case and I did not know homeopathy much then. I had read Clark and some small books, and way back he had referred a case of osteomyelitis. Multiple procedures done, and it continues to ooze. And this guy was from Kashmir. He did not come to meet me. He had come to meet that orthopedic surgeon. And he saw the case and he saw so many procedures, so many openings done. And he said, boss, this will not come under my thing. You know, I have a friend, you just go meet him. Trust me, I already told you, I did not know much of homeopathy then, the constitution, etc., etc. So way back, I had given him Silicea 6C, read in some book. Silicea 6C, not a single dose, Silicea 6C for a month. And he went to Kashmir. And second follow-up, he did not come directly to me. He went back to the orthopedic surgeon who assessed the improvement, and he was very happy. Meaning 1 month back before Silicea, what he had seen the leg, and you know after Silicea what he had seen, he was pretty impressed. And that case, you know, even till date he keeps sending all osteomyelitis cases. Almost 5-6 cases he has referred. Okay. So, you know, Silicea 6C I had given BD for 30 days. Right, wrong, I am not sure, but patient improved. I am getting, patients from the orthopedic surgeon. So, Silicea 6C. But as I have evolved, I have realized not all cases Silicea will help. Fine. I was lucky in that case, it helped. But I was not lucky in every case. I tried Silicea 6C, it did not help. And it is a matter of pride. They go back to the ortho person and he is evaluating. So then I realized, boss, all cases, you know, that is homeopathy. What is it? Individualization. Fine. So all cases Silicea 6C will not help. I was lucky in that case. And then I changed. I understood why it is happening, which leg, what was the emotion, what is his nature. Slowly I evolved as a homeopath. And then I have seen Merksol doing wonders. I have a case I have shared in one webinar. Again referred by the same orthopedic surgeon. Okay. Beautiful it has healed. He used to come limping. After accident, no, bone injury and bone has gone into decay, caries. And Merksol, very angry person, he was going in a state of rage and all. So there it is not Silicea, there it was Merck. Merck did beautiful, it did wonders. Okay. And one more case, I will share that. I had given Pteridia. Fine. Okay. One more case, it was Fluoric Acid. But the beauty is, if indicated, our remedies can do wonders. So, can you quickly observe something here? And can somebody, what is your observation? Have a look at the PPT, just observe there is something that is missing. Huh? What is it? Good. Yeah, Shweta and Aniket, they had a point. What is that point? I am talking to you about inflammation and immediately I jump to destruction. So what you need to understand in Silicea, if you again go back to your UG classes, you know Silicea is predominantly sorosyphilitic. You getting my point? So here and you see further also, Silicea will not produce more of growths. So Silicea has less tendency for psychotic thing. Okay. So Silicea, now this is where the miasm plays an important role. It is more sorosyphilitic. You are getting my point? Yes, anyway, good, I am happy you could observe, though it is an afternoon class. Good. So osteomyelitis, one remedy. When you have got nothing, you can think of Silicea. But take my statement with caution. Please go homeopathically, similia similibus curanter, try to match and then prescribe. So this is the action of Silicea on bones. Now another area I was talking to you was the fibrous tissue, the ligaments, the tendons. Okay. There again you can see Silicea causing destruction, Silicea causing inflammation. Okay. Now as a PG scholar we have to compare, because our focus is mainly practical classes, clinical classes. Fine. Now quickly, what remedies come to your mind keeping this thing, keeping the bone pathology? What are all the other homeopathic remedies that come to your mind? We'll take up those remedies and we'll try to compare. Okay, good. Meserium, symphytum, fluoric acid, mug. Good. Any other remedies? Fine. Kalkaria group, good, beautiful, agreed. Kalkaria. You know, calcium. Fine. Okay. Calcium carbonate. The first remedy, I'll start with A. The first remedy you should not miss is asafoetida. Okay. So having missed to name the remedy, can you think of the indications? Very good. Necrosis. Good, agreed. Asafoetida is again a syphilitic remedy. Fine. And we are limiting to the bone action. Yeah. Asafoetida has got a lot of things. GIT, etc. But limiting to the bone. Vaishnavi has a point that it is a remedy acting on the bones and it will cause necrosis. Good. Very good. Now, necrosis you have merc. Necrosis you have fluoric acid. Necrosis you have our own Silicea. Now, how do you differentiate asafoetida? Now, this is very important. Now, this is where we fail in our practice. We know asafoetida is producing necrosis, but how do we differentiate asafoetida from all those other remedies which are producing necrosis? Okay. Now, every remedy will have something unique. Now, what is that uniqueness that you have in asafoetida is the affected part is very sensitive. Artha aita? Ulcer agide, that part has been necrosed, but that necrosed part, in and around of the necrosed part is very sensitive. Okay? And Dr. E. Farrington says it is so sensitive that they can't even bear the softest bandage. Done? See, I mean, these are all your observations. This is where you become a better homeopath. Your observations. So they will not like anything, touching. So generally we think of, which are the other remedies we think of? We think of ophidias. We think of hepar. Okay? But I am talking to you specifically about caries of bones. Mind you, caries of bones. So this is what you need to have typed it in red, taken from E. F. Farrington. Softest dressing patient cannot bear. Now after asafoetida we have fluoric acid. Now what happens in fluoric acid? What happens in fluoric acid? Yes, very good. Again caries, yeah, good. Yeah, osteomyelitis, caries, necrosis, caries of long bones if you want specifically. But again, reading source books, they share their experience, and what they tell is, what is that common mistake we all make? We all give Silicea. Allah, a case of osteomyelitis, we give Silicea, and they say when Silicea has been abused, hope you are getting it. When you have a case of necrosis and you have abused or you have given Silicea and Silicea has not given any effect, okay, there they say think of fluoric acid. They have complementary relationship. Okay. So fluoric acid, long bones, and you all know, see, again if you read fluoric acid in E. F. Farrington, he says this is one of the strongest acids. It can dissolve anything. Correct, no? It can dissolve anything. So that excoriating thin discharges, excoriating, it is an acid. Excoriating discharges, they are the hallmark of fluoric acid. Never miss fluoric acid. Beautiful remedy. Okay. Now moving ahead, third remedy, Vaishnavi was telling, and this is Kalkaria. Now any vague idea what Kalkaria carp has? Huh? Okay, bony deformities. Yeah, see, if you look at, see now this is where the pathophysiology plays an important role. Calcium, which is very important in formation of the bone. So though you are taking calcium, it is not getting absorbed, assimilated, it is not getting deposited in the bone, and then you have some issues. Issues mainly with the spine. Spine is curved, fine, okay, or you have pain in the bones. When it is more of a deficiency, you can think of Kalkaria carp. Okay, so curvature of the bones, the long bones, the spine getting bent. Here more than the necrosis, here the problem is with the assimilation and deposition. Okay, fine. So Kalkaria carp, good. Kalkaria phos. Yeah, happy you are answered. Okay, good. More than injuries. Injuries, good. Shweta has a point. Kalkaria phos promotes callus formation. Which are all the other remedies? Symphytum ruta. Kalkaria phos. Okay, they produce or they help in union of bones. Now how are they helping in union of bones? They help in formation of callus. Okay, Kalkaria phos. Apart from that, anything else you can think of in Kalkaria phos? Anything else? See, Kalkaria phos also a remedy for pains along the sutures. And if the, like Kalkaria, what is it? There is no union, fontanelles open. And in Kalkaria carp and Kalkaria phos, how do you differentiate the fontanelles open? Yeah, anterior is open in Kalkaria carp. And Kalkaria phos, P for phos and P for posterior. Simple way to remember. In Kalkaria phos, the posterior fontanelles will be open. Okay. Silicea is also a very good remedy for open fontanelle. So pain along the sutures, as Shweta rightly said, it helps in non-union of bones, helps in formation of callus. Okay. Now few more remedies. One rare remedy, Angus Trivera. Many of you should be remembering this strong craving for coffee. Okay. Now what you have in Angus Trivera is something very, very interesting. They have caries of long bones. The tibia, the fibula, the humerus, knowledge of anatomy, all those long bones. And a specific exemption here is the lower jaw, if they go into necrosis. Okay, you can think of Angus Trivera. Moving ahead, you also have a spider. Must be two spider remedies I have included here for our discussion. And one is Arania. Any idea what happens in Arania? Arania is a spider. What happens in Arania? Acting on bones. What will it do? See, a kind of icy cold sensation in the bones. That's one thing. And violent boring pain in os calculi. In that bone, there will be violent boring pain and a kind of icy cold feeling. It's a subjective feeling what a patient has. Sensation. Patient is feeling the bone is like ice. If you touch, you will not feel. It is a subjective feeling. Okay, what you have in Arania diadema. I was also trying to tell you about another spider, Pteridion. In one of the videos I mentioned about generalities of spider, and then I have spoken about Pteridion. There you can just, when time permits, you can watch Pteridion. Phatak There are a lot of things in pteridine. Yeah, I mean, what is it that is very important for us in pteridine? Excessive sensitiveness or oversensitiveness to noise. Okay, very important. Fine. Second point is Dr. Phatak beautifully says, when no remedy helps, see, I don't know if I'm getting the line right. He says, when no remedy helps for osteomyelitis, think of pteridine. I have one bad case, again referred by the same orthopedic surgeon. He is not improving. He is not improving. Fine. This is one case I have flopped. 8-10 retakes have happened to the extent the patient has stopped coming to me. After reading it in Patak, I searched for his phone number and I called him, and I told one remedy I have to give you, please come. I mean, they are open. They stopped coming to me because he is not better. Otherwise, I have got nothing against. Fine. So for him, last month, after I read Phatak's, I have started him on pteridine. So we'll wait what the results are. So when he says it's almost specific, when nothing works, no remedy works. I told you 8-10 retakes I have taken in this boy. Fine. Very nice people, and he's having it for almost last 10 years. So they have undergone a lot of procedures, and they know, it keeps recurring. Last 2 years at least, luckily he did not go for any procedure, but he is not completely better. So somewhere my remedy is partially simillimum. I was not able to give him the right remedy. So I relooked at this case, Phatak's statement, tried to match, and convinced it could be pteridine, given him pteridine. We'll wait, I'll let you know. So that was about pteridine. One more syphilitic remedy we missed, and that was Auram. Any quick inputs about Auram? When Auram in caries? Yeah, good. Shweta's finger is pointing towards the right point. And this is where the knowledge of anatomy comes up. Caries of cranial bones. Okay? Caries of cranial bones. Caries of nasal bone. Caries of cranial bones, bones of the nose, bones of the palate. Okay? And it's a syphilitic remedy. Pains, aggravation, night. Fine, night pains. Okay? So, Auram, and one last remedy is strontium carb. I don't use, so strontium carb. Okay? One remedy given in your material for caries of bones. Now, what is special in strontium carb is caries of bones associated with diarrhea. So, if you have this combination and caries of bone, they have specified when the caries of bones, when it is specifically the femur, and if there is diarrhea. If I am right, it should be E.F. Harrington. I have taken it from his book. So he says strontium carb. Okay, fine. Yeah. Any questions? See, a lot of other remedies you have told. For example, symphytum. I have not had symphytum here because symphytum will not give rise to caries. Symphytum maximum can give rise to bony pains, or it can help in callus formation, and it can help in the union of bones, symphytum. One remedy I missed here is Kalkaria floor. Now, what happens in Kalkaria floor? Huh? Clothes. Very good. Yeah, that's what I wanted. See, Kalkaria floor, you will see more of growths. The growths that were missing in Silicea, osteochondromas, osteosarcomas, fine. You see growths which are more prominent in Kalkaria floor. And you know the growth in Kalkaria floor is hard. Naturally it's a bony growth. Not only bony growths in Kalkaria floor, any other growths. You shall have to take this point very seriously. Any other growth in Kalkaria floor will be hard. Okay? It could be a glandular growth, it could be any growth. In Kalkaria floor it will be hard. It will be indurated. Very important. So symphytum, even for example ruta, they are more for injuries. Ruta, symphytum, they are not that deep that they can bring in caries. So the miasm in those remedies will be a limitation. Ruta, symphytum will not be a syphilitic remedy, or at least may not be predominantly syphilitic. So you don't see more of destructive things in symphytum in ruta. Okay? In Kalkaria floor you see more of a psychotic thing. You see more of growths. Fine. Any other remedies you would like to add? Okay. Done? Our time is up. I wanted to finish the entire sphere of action of Silicea. But don't worry about the time and class. I mean, see, I have told you it's not how much we complete. That is not important. See, I am giving you an idea. Based on this, you can always prepare. Fine. But will not cut it short for the sake of time. At least the important thing. Now, see, last causticum we focus on something else. Now, Silicea, I am coming up with a new model that we can study a remedy like this. So, each remedy I am trying to give you different variations so that you know and you can pick it up and you can start preparing. So, anything to ask first thing or anything to contribute? Mark, I remember that case of a gentleman who had a bad accident. Okay, he was driving on his Luna on the highway, a lorry hit him and the leg, the tibia, fibula all broke, and he was taken to one of the biggest hospitals in Bangalore, and all the plate, screw, everything done. But there was a lot of oozing coming up. I have the video also. That patient was kind enough to share the video. So it was oozing badly, and that's when this gentleman had referred me. Very angry man, and everything should happen according to him. Even he is on wheelchair, but the entire house, everything, everybody should dance to his tune. Offensive discharge, I had taken anger contradiction from rage and offensive discharges and osteomyelitis, and I had given him Merck salt. Fine, and beautifully improved. So Merck, when you have more of offensive discharges, then you can think of Merck salt. Okay. Anything else? Done? Okay, thank you. Then next class we will try to complete the remaining part. We have just taken up bone, and every class if we start taking up one organ, then it will become very difficult. I have just given you an idea. So next what I will do is, I will be precise, okay, so that at least next class we will try to finish the pathogenesis of Silicea. Okay. So thank you.